What does radiation do to the brain?
Well, there's a lot of different kinds of radiation. So for the purpose of our discussion, we'll talk about radiation that we use to treat brain tumors. So radiation has the same effect on all tissues. What it does is it breaks strands of DNA. As you know, DNA is responsible for all cellular production. And so if you break the strands of the DNA, cells don't reproduce well. So the idea of using radiation in the brain, we try to be very focal to like a tumor area, but when we hit normal cells, it also has an effect of killing those cells or makes them so they can't divide or function properly.
Alright, and what are the side effects of treating brain tumors?
The side effects of treating brain tumors are many. First off, as you can well imagine, if we're disrupting the DNA in a cell, any types of tissues that grow very quickly can be affected by that, because you want to be able to disrupt that DNA when it's in the process of replicating or changing. So things like your hair can fall out, you can get a lot of nausea, a lot of vomiting because of the fact of what goes on in your GI tract. Also, side effects for treating brain tumors come a lot from what happens and where you're treating the tumor in the brain. I have a brain here. I'll show you. Not a real brain, a plastic brain, but different parts of the brain are responsible for different things. So, for example, these are the frontal lobes of the brain, and they're responsible for things like impulse control and making sure that you do the right thing even when you're tempted to do something else. The temporal lobe of the brain is an area where a lot of your motor function stays. So people that have problems in the temporal lobe will have seizures and that type of thing. In the back of the brain, the occipital lobe, and back here where your eyes come together in the back of the brain, so they come from the front and they cross over and go all the way to the back. If you damage this part of the area, it'll have an impact on your sight. So depending on where the things are at in the brain will determine what side effects or what lasting things will happen with the brain. So what side effects you'll have from the brain tissue itself.
And what are those side effects specifically?
Well, for example, if you had a tumor here in the frontal lobe of your brain and we took it out and hit it with radiation very hard, you may not have impulse control. So when you felt like doing something, you just do it, no matter what the situation was. If you were sitting in church and decided you wanted to sing a Beatles song, you just stand up and start singing. If you had a tumor here in the back of the brain near where your eyes come in and we had to take that tumor out surgically or had to radiate it or both, you could lose eyesight in one or both eyes depending on where it was, and it would not come back. So it depends a lot on where the location of the tumor is and where the radiation is delivered to where the damage is done.
So once you radiate something, the cells are pretty much gone?
Once you radiate something, the cells are pretty much gone. They form scar tissue, you get a lot of swelling. It's just like getting hurt anywhere else on your body. So if you were to cut your arm very badly, you would find that you would have the cells forming a scar, and scar tissue would form there. It looks a little bit different than your regular skin. Scar tissue always does. Same thing happens in your brain. When we do that kind of damage in your brain, whether through surgery or radiation, it also forms scar tissue and gets edema, gets swelling, and those types of things. So it never really comes back. Brain cells don't really regenerate. The best your brain can do is try to wire circuits around that damaged area, and it will do that.
Alright, so what medications do you put people on?
For brain tumors, there's a few different things. One is what's called a radiosensitizer, which is a medication that you can give to a patient that will make their tissue cells more sensitive to absorbing radiation, and that tends to make the radiation more effective. There's other medicines that affect the DNA of cancer cells directly. They also affect some DNA in normal cells that are given to patients to make sure that those cancer cells can't continue to grow. Another medication that's given for patients with brain tumors, as you can see, there's a lot of these red blood vessels here. Cancer cells need blood vessels too, and they get very highly vascularized. And so we give medications to keep those vessels from forming, keep them from growing, so that we starve the cancer to death, in fact.
So the brain never really does get back to normal?
The brain never really does get back to normal. Again, it tries to compensate sometimes, but if we do too much damage to the brain, there's just not a way for us to get it back to normal.
Alright, so how does the brain maintain homeostasis?
Well, the brain tissue itself maintains homeostasis like other tissues in the body do, and it's bathed in cerebrospinal fluid, And so it maintains a homeostatic environment, but also there's a part of the brain called the hypothalamus, and the hypothalamus is responsible for homeostasis throughout the body. It's actually right here in this brain that I just cut in half. This is your pituitary gland. This is the hypothalamus. And this is the part of the body that tells you if you're too hot, too cold, things like that. It also maintains homeostasis throughout the body. So if you had a tumor here, and we were to damage this part of the brain with radiation, this could easily cause problems with homeostasis throughout the entire body. So brain's a very important part not to hurt and not to get tumors in if you can avoid it.
Alright, so what about you? You told me something about you put seeds in the brain to help with radiation?
Yeah, seeds is the term that you use, but honestly there's areas of the brain and there are different types of devices that have radioactive compounds on them. And so typically when you have, let's say we had a tumor in the frontal lobe here. So what we would do is, this is under your skull, remember, and there's skin and hair over the top of it. So we take and make a cut and peel the skin back and then literally cut the top of the skull off and pick it right off so we could see the brain. Go in and take that tumor out, and where that void would be left, we would put a little wafer with radioactive material on it, or put some little seeds in there with radioactive material on them, and then put everything back together. And it's very, very low dose radiation, but it's delivered directly to the site where the tumor was. And so that's another way of delivering radiation, as opposed to a big machine like you've seen in the hospital. If you've ever had an injury where you've had an x-ray done, x-rays are not the same kind of radiation that we use in focally treating brain tumors, but it's a similar idea.
So do these seeds just go away, or do you have to like go back and take them out?
No, good question, but neither one, actually. They stay there for the life of the patient. You don't go back in and open their skull up to take those seeds or those wafers back out. They give very, very low dose radiation for a long period of time. And unfortunately, for many of these patients that have brain tumors, their life expectancy is not really long. So those seeds or those wafers stay in place.
So is there any other way to get radiation there, like through injections or something?
Well, not really. You don't want to expose any more of the body to radiation than you have to. See, instead of doing whole body radiation, which used to be done a long time ago, you do a lot of damage if you're doing radiation to several parts of the body. Remember, every cell is dividing. If you hit it with radiation, you can disrupt that DNA and you can kill that cell. Long term, you can also have other problems. So low dose exposure to radiation over a long period of time can cause cells to go haywire and cause cancer. You may have heard of that in the news and those types of things. But the reality is you want to be able to deliver very focal radiation. So rather than injecting a radioactive compound that covers the whole body or exposing the whole body to radiation, we want to be very focal and very surgical with how we deliver the radiation.
All right. I think that is all the questions I have.
Okay, very good.
Thank you so much.
You're very welcome.